You will need the following items in preparation for activating a new pod: your personal diabetes manager, or PDM, an unopened, sealed pod package, a vial of room temperature, rapid-acting insulin, alcohol swabs to clean the top of your insulin vial as well as your infusion site. Some of our users report using additional products to improve their pod wearing experience. When on the home screen, select More Actions and then select Change Pod. Your PDM will now take you step by step on how to fill and activate a new pod. The PDM will now show No Active Pod. Would you like to activate a pod now? Once you click Yes, the PDM will prompt you to fill a new pod with insulin. To fill a new pod, first remove the backing from the pod's cartridge. Use an alcohol swab to clean the top of the insulin vial. Assemble the fill syringe by twisting the needle onto the syringe and then remove the protective cap. Draw air into the fill syringe equal to the amount of insulin you intend to fill the pod with. Depress the air into the vial of insulin. With the needle still in the vial and your finger still depressed, turn the vial of insulin upside down. Fill the syringe with your needed amount of insulin. Be sure to remove any bubbles from the syringe. To do this, point the needle upwards and tap the side of the syringe to move any air bubbles to the top. Now you can carefully push out any remaining air bubbles. Locate the marked black arrow on the underside of the pod. This is the fill port. Insert the needle straight down into the fill port. It is easiest to keep the pod in its tray while filling. Make sure to completely empty the syringe into the pod. If you hear 2 beeps, and you still have insulin left in your syringe, continue filling until all of the insulin is transferred to the pod. The pod will beep twice, indicating the system is ready to proceed. Please note, it is important to hear these 2 beeps before you proceed. After you have completed filling a new pod, place the pod next to the PDM. The pod and the PDM should be placed side by side and touching before you press Next to begin the priming process. Press Next to begin priming your pod. The system will perform a series of safety checks and automatically prime the pod at this time. Once priming is complete, the PDM will beep, then prompt you on the next steps of pod application. With OmniPod, it's easy to find a comfortable location to place your pod. For optimum infusion at each location, be sure you rotate between your sites every time you apply a new pod. A new infusion site should be at least 1 inch away from the last site. Also, be sure to avoid placement over a mole, tattoo, or scar. When choosing a location, place the pod at least 1 inch away from your waistband for comfort. If you're placing the pod on your abdomen, make sure to apply the pod at least 2 inches away from your navel. If you're placing your pod on your arm or leg, position the pod vertically for comfort. The pod window may face up or down. If you're placing your pod on your abdomen, back, or buttocks, position the pod horizontally or at a slight angle for comfort. To ensure proper adhesion of the pod, clean your infusion site area thoroughly with alcohol swabs and let your skin air dry completely before applying your pod. When preparing your site for a new pod, remember your site needs to be cool, clean, and dry. Be sure your site is free of residue from soap, lotion, or excess body hair, as they can prevent the pod from sticking securely. You may need to clip or shave your infusion site before applying the pod. You may need other skin dressings to help your pod wear experience. As always, please consult with your healthcare provider for more instructions on these helpful products. The PDM will prompt you when it is time to remove the pod's adhesive backing. After choosing a location, remove the adhesive backing from the pod in order to place it on your site. Gently apply the pod to the selected site in the proper position. Try to place it flat and even on the skin to avoid any wrinkles in the adhesive. Once the pod is applied, run your finger around the outside edge of the adhesive to secure it in place. The pod's durable adhesive keeps it securely in place for up to 3 days. If necessary, several products are available to enhance adhesion. Ask your healthcare provider about these products. Avoid getting body lotion, creams, or oils near the infusion site, as these products may loosen the adhesive. When you have your pod applied to your skin, your PDM will prompt you to insert the cannula. If your infusion site area is very lean, you may consider the pinching up method to ensure successful cannula insertion. For the pinching up method, place your hand over the pod and make a wide, gentle pinch around your skin surrounding the viewing window. You will need to hold this position until the cannula is inserted, so make sure to find a comfortable position. When you are ready, press the Start button on the PDM. In an instant, the virtually pain-free cannula insertion process occurs. The PDM will now ask you to verify the cannula has been inserted into the skin. To be sure your cannula inserted properly, you can view the cannula through the cannula window. You can also check the position of the pink slide insert on the top of the pod. It slides towards the cannula window when the cannula is inserted. If you were pinching up, you can now release your hand from the site after the cannula has been inserted. The PDM can remind you to check your blood glucose in 1.5 hours to ensure proper insertion and infusion of insulin at the site. You may need to change the OmniPod for the following reasons. A low or empty reservoir. Your pod will alert you when you have a low reservoir and suggest a pod change soon. You can view the amount of remaining units at any time by checking the insulin gauge at the top of the status screen. When your reservoir contains less than 50 units of insulin, the icon changes to indicate the exact amount of insulin remaining for your convenience. A pod expiration. Every pod expires after 72 hours of use. If, for some reason, you cannot change it right away, that's okay. As long as you have insulin remaining, the pod will run an additional 8 hours after the 72-hour expiration alert. If the pod comes off your body. In the event you have an unplanned removal of a pod, you will want to put a new one on as soon as possible. And lastly, if you receive a hazard alarm, you will be instructed by the PDM to perform a pod change. If you are wearing an active pod, you will first need to deactivate it before removal. Turn on the PDM by holding down the Home/Power button and confirm that the PDM belongs to you on the ID screen. Select More Actions and then select Change Pod. Be sure your PDM is within the 5-foot range of your pod, then press Confirm to deactivate your pod. Deactivation will take a few seconds. Wait until you receive a message confirming that the pod has been deactivated before beginning to activate a new pod. Wash your hands thoroughly prior to handling the pod. Gently use your fingers to lift the edges of the adhesive tape from your skin. Remove the pod slowly to help avoid possible skin irritation. Use a combination of soap and water to remove any adhesive left on the skin. You may also use a standard adhesive remover. You may now discard the pod according to local waste disposal regulations. Returning your pods through our earth-friendly disposal program is quick and easy. Learn more by calling customer care at 800-591-3455. Once your pod has been deactivated and discarded, press Next. Now your PDM is ready to activate a new pod.